10 signs you have been emotionally neglected in childhood. Emotional neglect is a consistent pattern of failing to meet the emotional needs of a child. No parent always responds perfectly to a child's emotional needs each time. But emotional neglect is a pattern over time where the lack of meeting emotional needs leaves children with deep insecurity that can affect them throughout their lifetime. So here is a 10 signs you have been emotionally neglected in the childhood. Number 1. Insecure avoidant attachment pattern, disorganized attachment, and in extreme case, attachment disorder. Parents of children with an avoidant attachment tend to be emotionally unavailable or unresponsive to them a good deal of the time. They disregard or ignore their children's needs and can be especially rejecting when their child is hurt or sick. These parents also discourage crying and encourage premature independence in their children. In response, the avoidant attached child learns early in life to suppress the natural desire to seek out a parent for comfort when frightened, distressed, or in pain. People who form an avoidant attachment to their parents or parents while growing up have what is referred to as dismissive attachment in adulthood. Because they learn as infants to disconnect from their bodily needs and minimize the importance of emotions, they often steer clear of emotional closeness in romantic relationships. Dismissively attached adults will often seek out a relationship and enjoy spending time with their partner. But they may become unconformable when relationships get too close. They may perceive their partners as wanting too much or being clinging when their partner expresses a desire to be more emotionally close. When faced with threats of separations or loss, many dismissive men and women are able to focus their attentions on other issues and goals. Others tend to withdraw and attempt to cope with the threats on their own. They deny their vulnerability and use repressions to manage emotions that arouse in situations that activate their attachment needs. When they do seek support from a partner during a crisis, they are likely to use indirect strategies such as hinting, complaining, and sulking. Number 2. Significantly less positive social interactions. As the Harvard Women's Wealth Watch reported, dozens of studies have shown that people who have satisfying relationships with family, friends, and the community are happier, have fewer health problems, and live longer. In fact, the research found that those with close social ties and unhealthful lifestyles such as smoking, obesity, and lack of exercise actually live longer than those with poor social ties but more healthful living habits. However, needless to say, people with both healthy lifestyle and social close ties live the longest of all. People with less positive interactions will fear of doing something in public, fear that others will embrace or ridicule everything that is done. Therefore, people with social phobia tend to avoid meeting or being with people other than family. As a result, he will find it difficult to make friends and tend to be unable to maintain friendships. Social interactions are considered normal, but become a problem for people with social phobia are talking to strangers, making eye contact, dating, entering a room full of people, starting a conversation, and even going to school or work. Number 3. Poor peer relationship. Peer relationship problems occur when students have trouble cooperating with others and have trouble making friends. Peer relationship problems can lead to friendship with peers who make poor choice, an inability to maintain quality friendship, being bullied, and later developments of internalizing concern. Extensive research has demonstrated associations between certain family characteristics and high rates of child conduct problems. In particular, unsuitable discipline practice, example frequent and harsh punishment, inconsistent and ineffective limit setting, and family discord, like marital conflict and parental hostility, appear more commonly in families of conduct problem children than in families of non-problematic children. Parents also influence a child relationship directly by designing, mediating, supervising, and advising children about this relationship. Parents may build bridge between their child and peers by scheduling play dates, help their child engage with others and talk about difficulties. Intervention and support of peer relationship problems focus on increasing relationship building skill, using effective communications, improving social skill, and enhancing problem-solving skills. Number 4. Disruptive and impulsive behavior, including aggressions, hostility, and oppositional. Impulsivity is the tendency to act without thinking. For example, if you blur something out, buy something you had not planned, or run across the street without looking. To a degree, this kind of behavior is common, especially in children or teenagers, and isn't necessarily a sign of trouble. So are these impulsive behavior symptoms and examples? Binging, overindulging in things like shopping, gambling, anything. The extraction of property, destroying your own or someone else's things in a moment of anger. Escalating problems, taking minor situations and making them more urgent and important than necessary. A well-characterized potential marker for addiction is impulsive choice, stably measured by delay discounting or DD paradigm. While genetic influence partly account for inter-individual variance in impulsivity, environmental factors such as parenting practice may have an important role. If impulsivity is a part of conditions, the treatment depends on the cause. One general approach is applied behavioral analysis, where you learn to work through or better handle situations that tend to trigger impulsive behavior. Your doctor also might recommend medications. Antidepressants like selective serotonin reuptake inhibitor can help with impulse control disorder. Number 5. Lower cognitive functioning. When a person has trouble remembering, learning the new things, concentrating, or making decisions that affect their everyday life, it is a sign of lower cognitive functioning. People who are organized with high level of self-discipline may be less likely to develop mild cognitive impairment as they age, while people who are moody or emotionally unstable are more likely to experience cognitive decline late in life, according to research published by the American Psychological Associations. Both authoritarian and permissive parenting style were negatively related to children's cognitive ability, indicating that children with mothers who report higher level of authoritarian and permissive parenting practice have lower cognitive ability scores. Parents may have high expectations of their children's academic performance, and some may demonstrate this by urging their child to achieve good grades, while others may overreact when the child makes mistakes. It is also can make you have cognitive functioning problem. Number 6. Low self-esteem and self-compassion. If you have several issues like saying negative things and being critical about yourself, or joking about yourself in a negative way, or focusing on your negatives and ignoring your achievements, or maybe you blaming yourself when things go wrong, or maybe thinking other people are better than you, it is a sign that you have a low self-esteem and self-compassion. Unhappy childhood where parents or other significant people such as teachers were extremely critical. Poor academic performance in school resulting in a lack of confidence. Ongoing stressful life events such as relationship breakdown or financial trouble. Avoid criticizing yourself to others because it can reinforce your negative views and also give other people a negative opinion of you. You can help to boost your self-esteem by giving yourself a treat whenever you succeed in doing something hard or just for managing a particularly bad day. Number 7. Attention problem. This includes difficulties such as inattentions, poor concentrations, being easily distracted, losing interest easily, daydreaming, not listening, or being disorganized. They can also include oppositional or defiant behavior, such as frequent temper tantrums, arguing with others, and not doing order. Attentions play a critical role in almost every area of life, including school, work, and relationship. It allows people to focus on information in order to create memories. It also allows people to avoid distractions so that they can focus and complete specific tasks. ADHD can be prevented or cured, but spotting it early plus having good treatment and education plan can help a child or adult with ADHD manage their symptoms. Number 8. More behavioral issues, including conduct disorder symptoms. People with the symptoms of conduct disorder include not caring about social norms of good behavior, ignoring the right and feeling of other people, enjoying causing harm, lying or manipulating people, committing physical or sexual violence, and hurting animals. Symptoms are divided into 4 main groups. They are aggressions, distractions, deceitfulness, and violations of rules. So what is the main cause of conduct disorder? The exact cause of conduct disorder is not known, but it is believed that combinations of biological, genetic, environmental, psychological, and social factors play a role. In biological, some studies suggest that defect or injuries to a certain area of the brain can lead to a behavior disorder. Number 9. Less emotional knowledge. Difficulty recognizing angry face. Low emotional intelligence refers to the inability to accurately perceive emotions in both yourself and others, and to use that information to guide your thinking and actions. When someone has a low EQ, there are many ways it can present itself. People with lower emotional intelligence might find it harder to accurately identify emotions, recognize how other people feel, or express and honor emotional needs. It is true that these tendencies could create problems with relationships. People with low EI may also have poor emotions regulations and find it difficult to use their emotions to attain personal goals. Number 10. Symptoms of anxiety disorder. An anxiety disorder can make it difficult to get through your day. Anxiety disorder symptoms include feeling of nervousness, panic, and fear. You may also have physical symptoms such as sweating and a rapid heartbeat. So what is the main cause of anxiety? Difficult experience in childhood, adolescence, or adulthood are common triggers for anxiety problems. Going through a stress and trauma when you are very young is likely to have a particularly big impact. Experiences which can trigger anxiety problems include things like physical or emotional abuse. The 2 main treatments for anxiety disorder are psychotherapy and medications. You may benefit most from a combination of the 2. It may take some trial and error to discover which treatments work best for you.